everyone, this is part 4 Techniques and Approaches Used in Psychological Consultancy for Families. We have family therapy, cognitive behavioral therapy, play therapy, and other approaches and techniques. We're going to start with A. Family therapy. Psychological therapists are being asked to provide more than just therapy to help improve outcomes for patients in mental health services. Clinical organizational consultation is seen as a way to indirectly influence how other mental health professionals provide care to patients. Consultation helps staff develop their therapeutic skills and support reflective practice, which is consistent with the goal of creating compassionate organizational cultures. Consultation aims to increase staff confidence and improve patient care by increasing understanding and insight into patients. There are different models of consultation, and it should not be confused with clinical supervision. Being competent in working psychologically across teams and care system is now a fundamental aspect of a practitioner psychologist's role. Additionally, professional school counselors are becoming more involved in strengthening relationships between schools, families, and communities. They can act as a liaison between parents and community agencies to facilitate collaborative efforts, and their primary focus is prevention, which can be achieved through maximizing the consultation function. Professional school counselors are uniquely positioned to provide both traditional and innovative services to meet the needs of children and families. The changing landscape of schools has resulted in a growing population of students with academic, personal, and social problems that impede with their academic success and family or personal life. The traditional education methods are no longer sufficient to meet their needs, and professionals are in a unique position to be proactive and address these issues. The role of school counselor has been redefined as school reforms have taken place, and they are expected to work collaboratively with other schools professionals to strengthen relationships between schools, families, and communities. Through collaboration, school counselors can gain a better understanding of what other parts can contribute and how they can function. School counselors can act as a liaison between parents and community agencies to facilitate collaborative efforts that improve outcomes for students. Through consultation, school counselors can work directly with teachers, family members, and the system with which these groups live and work and help promote positive growth for students. Prevention is the primary focus of school counselors and can be best achieved by maximizing the consultation function. Professional school counselors are well positioned to provide both traditional and innovative services to meet the needs of children and families. By leveraging consultation as a tool, they can help break down barriers to academic success and improve the overall mental health and well-being of students and children. Fundamental ideas in family system therapy. Well, Mary Bowen, a psychotherapist who created family system theory, is the inspiration for family system therapy. According to Bowen, it is founded on 8 interconnected ideas. Well, I'm gonna present to you these 8 concepts. Triangles are 3-person connection systems that serve as the foundation for other emotional systems. Differentiation of the self, the ability to keep one's identity. Individuals with high degrees of differentiation may pursue goals autonomously whereas those with low levels of differentiation rely more on external validation. Nuclear family emotional process. This relates to how the family interacts emotionally. These patterns might include marital conflicts, partner dysfunctions, kid impairment, and emotional estrangement. Family protections occurs when parents project their difficulties and fears onto their children. This can have an impact on how children develop and cause emotional issues for other family members. The process of multi-generational transmissions outlines how people choose spouses with comparable levels of differences as themselves. Each generation has increasingly fewer degrees of differentiation. To resolve disagreement within a family, some individuals might isolate or cut themselves off from other members of the group. Breaking off past ties without resolving the matters may put future relationships under pressure and stress. Bowen felt the birth order had an effect on family dynamics, including parental expectation, sibling interactions, and parental punishment practices. The social emotional process. According to this hypothesis, many of the elements that influence family also affect society. Social views, cultural development, and disputes may all have an impact on families. This theory-based treatment may include a variety of strategies aimed to benefit both individuals and the entire family unit. Some of the approaches that may be employed based on the needs of the family are the following. Intergenerational family therapy. This technique focuses on understanding how generational influences have affected both individual behavior and how the family unit functions. It helps family understand how patterns acquired from previous generations are affecting the family and learn new ways of interacting. Psychoeducation entails training family members about many elements of mental health and therapy. This might be useful when one of the family members is suffering from a mental illness. Structural family therapy focuses on assisting people in identifying and comprehending how the families are constituted. The idea is to assist individuals in improving their organization as required and learning how to interact more effectively with one another. B. Cognitive behavioral therapy. Cognitive behavioral therapy is a form of psychological consultancy that focuses on the connection between thoughts, feelings, and behavior. The therapists work with family members to identify negative patterns and thinking and help them develop more positive coping strategies. CBT can be useful for families struggling with a wide range of issues such as anxiety, depression, behavior problems. Some common techniques are cognitive restructuring. This involves identifying and changing negative patterns of thinking. Relaxation techniques, such as deep breathing and progressive muscle relaxations. Behavioral activation. This involves developing strategies to increase positive behavior and activities that promote well being. C. Play therapy is a form of psychological consultancy that is used with children and adolescents. It uses play and other creative activities to help the children express their thoughts and feelings. It can be beneficial for children struggling with a great range of issues, such as trauma, anxiety, and behavior problems. Sand play, art therapy, play-based cognitive behavioral therapy are all part of this. Other approaches and techniques include emotional focus therapy, dialectic behavioral therapy, mindfulness based therapy, and narrative therapy, in which we can approach and focus on developing new positive stories about families' experiences and relationships, putting the bright side forward and working on resolving any underlying issues. Well, Hope that was helpful. Thank you all for listening.